Guys, it's November the 6th, 2024, and I hope everybody's having a wonderful dry day wherever you are located at. It is pouring the rain here in South Carolina today. I was just about to walk down to the place where I usually film at, and the rain just started coming down. It wasn't raining earlier, but I saw rain was on the forecast. It's actually supposed to rain here for the rest of the week this week, so we really needed it. We really needed the rain, so it's okay. I just hope that it doesn't interfere with today's video, and I hope that it's not super loud as I'm trying to talk. But anyway, like I was saying in yesterday's video and the day before, that I wanted to talk about what an ERCP is. And, it's one of those things that if you do, in fact, have any kind of pancreatic problems or, not just pancreatic problems, but gallbladder problems or, anything with the upper GI system, if they need to do any kind of work at all, a lot of times they're going to do an ERCP. And I unfortunately have had multiple ERCPs done. And when it gets to the point where you really start to have pancreatic problems, ERCPs become one of those things that you're going to have all the time. It's just part of the game. And the reason I want to talk about this today is, just try to ease up a little bit of the fear behind having to have one of those procedures done. And just like when I was talking about doing an endoscopy or endoscopy, I just wanted to kind of ease the fear and just bring a little bit of education to what it is, what it's like. Now, I will say that an ERCP can be rather painful depending on what they're doing. And I've had some pretty painful ERCPs in the past. But that was really when they went in and started to dilate my pancreatic duct. That's when things got really, really difficult, and I woke up in a lot of pain. As a matter of fact, there were a couple times that I asked them to keep me in the hospital overnight after having an ERCP done, because I was in so much pain after I woke up. And when you have an ERCP, it's really very similar to having an endoscopy done, except when they do an ERCP, like I was saying, they go in there and they use some tools. There's a bunch of little tools and stuff like that they can use in the ERCP, and they'll go in and do things like try to open up your gallbladder duct. They will go in there and do some stuff with your gallbladder, open up your pancreatic duct, place stents in your gallbladder or in your pancreatic duct. They'll drain cysts off, which I've had them do all of that. I've never had them place any stents or anything in my gallbladder before, but I have had them do a lot of stuff in my pancreas. But like I said, I wanted to talk about this today, bring a little bit of an awareness to it, and just kind of ease a little bit of the fears. If it's one of those things that you've been going to a specialist and they told you that they're probably going to have to perform an ERCP, I just wanted to like I said, just make it a little bit easier, just give you an understanding of what it's like, what they do, and, like I said, just make it a little bit less fearful, so that when you go into it, you know what you're walking into. Just want to go and start off today's video and just say, basically, the things, the tips and the tricks that I gave you the other day for having an endoscopy done apply to this as well. When you go in for the procedure, it's going to be one of those things, they are going to put you to sleep for an ERCP. Now, I did get some feedback from some people in the UK that were saying with an endoscopy that, it's a little bit different there, and that they don't actually put you to sleep all the time there. And the healthcare system in Europe is a little bit different than what we have here. So, I don't know what, specifically what it's like to have an ERCP done over there. I just know what it's like here in the States. And like I said, they do put you to sleep for an ERCP here. You're completely under. And when the times that I've had them done, they gave me the propofol, which is like the mother's milk. It's that white stuff. that they pull out of that big bottle, and they inject it right into the IV, and it knocks you out. I mean, you're gone. So once again, it's one of those things where you're gonna have to fast before the procedure. No food or drink after midnight. It's basically gonna be like 8 hours before the procedure is performed. They don't want you to eat or drink anything. You're not gonna want to take any of your diabetes medications, just like an endoscopy with this procedure as well. Same thing with the clothing. I would wear loose fitting, easy to get off clothes. Because you are going to have to put the gown on. Just like I was saying the other day as well, go ahead and remove your jewelry. I would go ahead and take your partials out. Make sure that you have like a case for you to put your glasses in, because you are going to want to wear your glasses in there, but they're going to make you take those off. And you just want to make sure you got something to put your glasses in so they don't get scratched or whatever. Take your rings off. Make sure that you can get those off easily before you go into the procedure, so you're not struggling to get those off the day of. Once again, don't eat or drink anything before the procedure. You're going to need to make sure that you have someone to give you a ride, because you are going to be put under, and they're not going to want you leaving the premises without somebody driving you. So you will have to have somebody drive you there. And it's just like the endoscopy. They're going to want to see proof that you have a driver, so they're probably going to ask for that person to, sign a piece of paper or whatever. But it's just part of it. And, you are going to have to put the gown on. They're going to make you take your socks off and put those little sticky socks on, just like I was talking about the other day. So it's very, very similar. They are using, that flexible tube with a scope on the end, with a light on it as well. But they, like I was saying, that, they do also have some tools that they can use. I know for a fact they've got like little claws. They've got like a little balloon, that they can place like into the pancreatic duct, and they can inflate it, and it will dilate your pancreatic duct. They can use the ERCP to place stents in there, which I've had done a bunch of times. My pancreatic duct became completely blocked off. I ended up with pancreatitis back last year in April. And when I was in the hospital, they discovered that my pancreatic duct was completely closed off. And so what they did was they told me we're going to have to do an ERCP. And it was my first time having one done. And when I went in there to have it done, like I said, my pancreatic duct was completely closed off. It was not open at all. So I was in a constant state of pancreatitis for like a couple months. And they went in there and tried to open up the pancreatic duct, and it was a big to-do. They couldn't get in it. My pancreas was like really, really, really inflamed during that period of time. So what the doctor decided to do was go in there and place stents into the cyst that had grown on my pancreas. I had multiple cysts that had grown on my pancreas, so they needed to drain those off. So they placed stents that ran from the cyst into my stomach. So they drained off into my stomach, and what they were really hoping to happen was they were hoping that they could drain the cyst off, and that it would relieve some of the inflammation in my pancreas, so that it could allow them, once they got that swelling to come down a little bit, it would allow them to try to place a stent into that pancreatic duct. So, like I said, they went in there and they placed a couple stents, because I had multiple cysts that were growing on my pancreas, and they placed those stents in there, drained it down. I went back a couple weeks later, and my pancreas had reduced in swelling enough for them to actually place a stent into my pancreatic duct. And what they did is, it was multiple ERCPs. So they placed the initial stent, which I'm not gonna lie, was very, 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 very painful. They had to dilate my pancreas when they did it. So they placed like a balloon in there and then blew it up, and then placed that first initial stent. And like I said, that was very painful. When I woke up from that, I was rather upset. I was screaming bloody murder when I woke up from that procedure. And I ended up staying in the hospital that night because I was in so much pain. And then I ended up staying again a couple times later after that, because what they were doing was they placed a stent, and then I went back another time, and then they pulled that stent, and then they placed 2 stents. And they did that multiple times until they got up to 4 stents in my pancreatic duct. What they were doing is they were trying to stretch it out and open it up. And after they placed 4 stents, I went in there, and then they started removing the stents one by one until we got down to just 1. And then they removed that last stent and checked it out, and they said, okay, your pancreatic duct's staying open, so we're going to leave it be. And I haven't had to have any more stents placed since. They removed my last stent, I think in April of this year. So it was a pretty long process, pretty lengthy, and there was a lot with it. But what is an ERCP? Well, ERCP stands for, I've got it right here. It's an endoscopic retrograde cholangiopancreatography. I hope I pronounced that right. So during an ERCP, healthcare providers use an endoscope and x-rays to observe injectable dye traveling through your pancreatic and bile ducts. And what they do is, if you guys are familiar with what contrast is, they'll inject contrast in there while they're doing the ERCP so that they can watch the flow through. And I've looked at a bunch of my reports from when I've had it done, and it'll say contrast, no blockage, contrast flew freely through pancreatic duct, and all that kind of stuff. So ERCP helps providers identify and diagnose conditions related to your ducts, like gallstones, tumors, and strictures. Through the endoscope, they can treat them during the procedure. So what is an ERCP, or endoscopic retrograde cholangiopancreatography? If your healthcare provider suspects you might have a problem in your biliary system, they might order an ERCP test to look for it. ERCP stands for the endoscopic retrograde cholangiopancreatography. It's a type of imaging test that allows healthcare providers to look inside your bile ducts and pancreatic ducts. The long name spells out the different types of technology involved in the process. Endoscopic refers to endoscopy, which means passing a tiny camera on a tube down your throat into your small intestine. While you're under sedation, they pass a smaller tube through the endoscope to reach your bile ducts. Through this smaller tube, they inject a contrast dye backward into your bile ducts and pancreatic duct. This is what the retrograde refers to. Cholangiopancreatography refers to the photographs they take. Cholangio is related to the bile ducts, and pancreato is related to the pancreas. Contrast dye helps the insides of your tiny bile ducts and pancreatic ducts show up better in x-rays. This allows healthcare providers to see possible blockages in your ducts, like gallstones, tumors, or scar tissue, causing narrowing of the ducts. Through the endoscope, providers can also treat these issues on site. So why would I need an ERCP? Your provider might suggest an ERCP if you have symptoms that suggest a problem in your biliary system, such as unexplained upper abdominal or biliary colic, signs of stalled bile flow, or bile leakage like jaundice. The ERCP procedure can help diagnose and treat common issues affecting your biliary ducts, such as inflammation, narrowing caused by scar tissue. And that's what I had. I had a bunch of scar tissue in there as well. Gallstones in your common bile duct. And another thing too, which isn't talked about very often, but a lot of people end up with pancreatitis because gallstone will drop from the gallbladder and it'll fall over because they're right across from each other. And a gallstone will fall out of the gallbladder, and it'll drop down and get lodged in the pancreatic duct. And what ends up happening is when a gallstone gets stuck in that pancreatic duct, the pancreatic enzymes can't escape the pancreas, which leads to those pancreatic enzymes being stuck in there, and it creates autodigestion. So what's happening is your pancreatic enzymes are actually eating your pancreas, which causes pancreatitis, which is very, 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 very painful. Gallstone pancreatitis, which I didn't even see this, I'm just looking at it right now, but gallstone pancreatitis is one of those things, like I was just saying, tumors or cancer in your bile ducts, and bile duct leaks or other injuries. So how does an ERCP work? ERCP combines endoscopy with fluoroscopy, a type of moving x-ray. Fluoroscopy can help show how well fluids are flowing through your biliary ducts. If fluids are leaking, or if they're stalling and backing up in your biliary system, your provider will be able to see this and look for the source of the issue. The endoscope allows your technician, endoscopist, to physically access the site. This is how they inject the contrast dye that helps make fluoroscopy work. It also allows them to treat issues when they find them. Endoscopists can use long, narrow tools to perform minor procedures through the endoscope. Who performs an ERCP? A gastroenterologist typically performs an ERCP. Gastroenterologists are specialists in conditions related to your digestive system, which includes your biliary system. They're also specialists in performing endoscopies. They train to perform endoscopic procedures that can substitute for minor surgeries. How should I prepare for my ERCP test? Your healthcare provider will give you personalized instructions to follow before your procedure. In general, they'll ask you, don't smoke, eat, chew gum, or drink anything but water for 8 hours before the test. Discuss your current medical conditions and medications with your provider in advance. They might ask you to discontinue certain medications before the test, such as blood thinners. Once again, if you're on blood thinners, they're most likely, and I've actually gone before and told them I forgot, because I completely forgot to bridge. I was taking my blood thinner, and when I got there that morning, I was completely honest with them, because I didn't want to end up and have some kind of bleed, and then they don't know what to do. Because when you bridge, they put you on that Lovenox, and that Lovenox has a very short half-life. I take Eliquis, which is a very long-acting blood thinner. It stays in your body for like 3 days. So they'll want you to stop taking your blood thinner for 3 days, bridge with the Lovenox before you do this, because they can potentially cause a bleed while they're in there, and it can end up being big trouble. Another thing too is that they're not going to want you to take your diabetic medications, so like no Jardiance, no metformin. They're not going to want you to take your fast-acting insulin the morning of. They will allow you, now this might be different for different providers or whatnot, but like I used to take long-acting insulin at night, and they would tell me to cut my long-acting insulin in half. So I would only take half of it the night before my procedure. And I was taking like 20 units, so they just tell me to take 10. And the reason is they just don't want your blood sugar to drop while you're in the middle of the procedure. Discuss any prior reactions or allergies to the contrast dye they use in the test or the anesthesia. Arrange for a ride home. Like I was saying, after the test, the anesthesia will take 24 hours to wear off. So what happens during an ERCP procedure? ERCP is an outpatient procedure. It can be inpatient. You know, it's one of those things that you might have to stay sometimes. It's an outpatient procedure, which means you get to go home the same day. The procedure can take 1 to 2 hours. You receive anesthesia through an IV to sedate you. You may or may not be awake. But either way, you probably won't remember any of it. You'll need someone to drive you home afterward. During the diagnostic portion of the ERC procedure, your provider will numb your throat with a liquid anesthetic to reduce discomfort as you wish. Insert the endoscope through your mouth and guide it carefully down your esophagus and stomach to the top of your small intestine, duodenum. It projects images onto a screen. Using the video, locate the opening to the bile and pancreatic ducts inside your duodenum. Slide the smaller tube through the endoscope catheter until it reaches this opening. Then slide it inside, inject contrast dye through the smaller catheter into the ducts. Use fluoroscopy to take real-time video x-rays as the dye travels through the ducts. Fluoroscopy works through the brief bursts or pulses of x-ray beams. It's considered a safe amount of radiation. Check the images for problems affecting your ducts like obstructions, swelling, or leaks. If your provider finds an issue during the procedure, they'll do what they can to fix it through the endoscope. Using tiny instruments, your endoscopist may break up or remove gallstones, remove tumors or tissue samples for biopsy, dilate or stretch narrowing ducts to widen them, place a stent inside a duct to keep it propped open, repair a leak or injury in your ducts, make a small cut into the muscle surrounding the opening to the ducts to open it up. This is called a sphincterotomy. Sphincterotomy. I can't pronounce that. But anyway, sorry. What should I expect after the ERC procedure? After the procedure, remain at the medical center for about an hour or two while the anesthesia wears off. Then your driver will take you home. You'll be a little groggy or spacey for the rest of the day. You may have some mild discomfort for a day or two after the procedure. Symptoms might include, and this is another one of those things where they do pump you up with gas so they can kind of open you up a little bit, so you might be a little bit gassy after this. Sore throat, difficulty swallowing, because the endoscope might irritate your throat. It might help to stick to soft foods or liquids until it feels normal again. I can't recommend having a nice hot cup of coffee after having one of these done because your throat does hurt a little bit, and that hot coffee can help soothe that for you. Bloated stomach or gas pain, like I was saying. The endoscope blows gas into your GI or gastrointestinal tract to inflate it for better viewing. You might feel this briefly until it passes. And nausea. This is a potential side effect of anesthesia, which will wear off the next day. I cannot suggest more. If you do usually get nauseous from the anesthesia, let your nurse know at the beginning of your procedure, because your nurse is going to be in there speaking with you in the beginning. Let them know that you get really nauseous when you have a procedure done, and they can go ahead and give you a shot of Zofran before you even wake up. And I cannot speak highly enough about that. I didn't know that they could do that until one of my last ERCPs I had done. But I was talking with the nurse, and I told him, I said, I get really nauseous when I have these done. She said, oh, we can give you Zofran before you wake up. When I woke up, I didn't feel nauseous one bit. And I get nauseous every single time. So if in fact anesthesia makes you feel like that, which it does for me every time, just tell them, and they can give you Zofran before you wake up. So what are the potential risks or complications of an ERCP? Complications occur in approximately 5 to 10% of ERCP procedures. This is one of those ones that they can cause pancreatitis by going in there. The risks depend partially on your pre-existing conditions and what type of therapeutic procedure you have during the ERCP. Your gastroenterologist will discuss the potential risk with you in advance. Possible complications include adverse reactions to the sedative, allergic reaction to the contrast or dye. And if you've had contrast before in the past and you didn't have any problems, you're probably not going to have any problems this time either. But it's one of those things, talk with your doctor. Injury to your GI tract from the endoscope. This could cause internal bleeding or, in a severe case, a hole. But this, once again, it's a very small percentage of people. I've never had any problems. Injury to your bile ducts from the endoscopic instruments causing a bile leak. Infection to your biliary system. Your healthcare provider may give you antibiotics in advance to prevent this. And irritation and inflammation of the pancreas due to the procedure. Once again, it can cause pancreatitis. And I did get pancreatitis one time after having one of those procedures because my pancreas got so irritated. But I was in the hospital. It only lasted a couple days. They took care of it. They gave me plenty of fluids, which when they give you a couple bags of fluids, and that's another one of those things. If you're going to have an ERCP done, just tell them that you prefer to have, a bag of fluid. Just ask, or a couple. I always do. Now, there is a shortage on saline bags right now, so if you have to have one done right now or maybe in the next few weeks or something, they might not be able to do that because right now they're basically only giving bags to people that are in dire need of having one done. They're being rather careful with those saline bags right now. If you're pregnant during the procedure, there's a low risk of harm to the fetus from the radiation during the fluoroscopy. Your doctor will ask you in advance if there's a chance you're pregnant. If so, they'll attempt to reschedule your procedure and minimize your radiation exposure if necessary. And results and follow-up. When should I know the results of the test? Your endoscopist should be able to discuss your ERCP procedure with you immediately afterwards, unless you still feel groggy from the anesthesia. And they always come in and talk to you right after. When you wake up, the doctor's going to come in there and talk to you. And now don't take that word for, as solid, but because it just depends. Sometimes the doctor's got 10 ERCPs they have to do that day, and maybe yours, was only supposed to take an hour and it went on the 3 hours. They might, have to rush to the next room. You might have to wait a little while to talk to the doctor. And there have been times that I was like, I don't want to wait. I just want to go home, and I'll talk to him later. And I just did a virtual appointment with him like the next day. But for the most part, they always come in the room and talk to me after they're done. If your ERCP didn't find anything, you might need a different type of test next. If the procedure wasn't successful in fixing your issue, or if your biopsy results reveal a new problem, you might need to follow up with a different type of procedure. Your healthcare provider will discuss the next steps with you. So when should you call your healthcare provider? Is, after your ERCP, if you have severe abdominal pain or swelling, chest pain or difficulty breathing, fever, vomiting, or other signs of infection, rectal bleeding, or black tarry stools. So if you have any of those symptoms after the procedure, you definitely need to contact your healthcare provider. What's the difference between an ERCP and an endoscopy? ERCP is an advanced technique in endoscopy. The standard upper endoscopy procedure, I'm not even going to try to pronounce that one, only goes as far as your upper GI tract. An ERCP uses an extension with the standard endoscope, a second catheter that slides inside the first to reach your biliary ducts. This mini endoscope extension allows the endoscopist to operate directly in your ducts. ERCP is the only endoscopic procedure that allows this. While other endoscopic procedures like MRCP and EUS can visualize your bile ducts and pancreatic ducts, they don't provide the same access for treating them. And is ERCP a major surgery? ERCP isn't surgery in the traditional sense, which means cutting into your skin to access your organs. ERCP is an endoscopic procedure, which means it goes into your body through a pre-existing opening, in this case, your mouth and your throat. But an endoscopist may operate through the endoscope during an ERCP, like I was saying earlier. Healthcare providers sometimes refer to operations through the endoscope as endoscopic surgery. These operations are surgical in the sense that they might involve cutting or stitching inside your body, but they're generally minor procedures and they involve fewer risk and a shorter recovery than classic surgery. So would I have an ERCP for pancreatitis? You might have an ERCP for pancreatitis if your healthcare provider believes that something in your bile ducts or pancreatic ducts is causing it. Gallstones stuck in your ducts are among the most common causes of acute pancreatitis. Like I was saying earlier, I didn't know that was one of the most common causes though. If this happens to you, you might need ERCP to remove the blockage. If you have chronic pancreatitis, the inflammation may have caused scarring and stricture in your pancreatic ducts. In this case, you might need ERCP to help stretch them out again or place a stent to prop them open. This helps to ensure that pancreatic juices can keep flowing through the ducts. So, guys, like I was saying, it really depends on what they have to do. When they go in there, if they have to place stents, if they have to dilate any of the ducts or whatever, how painful they are. But for the most part, it's not that bad. I've had multiple. I think I had like 12 of them done last year alone. There was only like once or twice that it was painful, and there was one time that I'm not gonna lie to you guys, it was rather painful, but that was the first time that they went in there and they stretched that pancreatic duct open. It just irritated my pancreas, and when I woke up I was in the middle of pancreatitis, and it just hurt, and I mean it was pancreatitis, but they got my pain under control. It took them quite a while. But the one thing that I will say, and this is something that you guys can do, if in fact you have an ERCP done and you're in a bunch of pain after you have it, you can ask the nurse for a bag of ice, and they have those big sample bags, that they put different kinds of samples in. They're big plastic bags. A lot of times they have those Ziploc bags too, the big gallon size Ziploc bags. Ask the nurse to bring you 1 or 2 of those bags of ice. They also have those little bags that they can crack. You can get 3 or 4 of those bags. That's another great option as well. Just ask them for those ice packs, and there's 2 different kinds of chemicals in them or something, and when they squeeze them, the one inside pops, and then there's a chemical reaction that happens inside the bag, and it gets super cold. It gets ice cold. If you take a couple of those bags or a bag of ice, take a towel or something like that and place it on your stomach, then place those cold packs on there, and just let it sit on your stomach after the procedure. I have found that placing ice on your stomach on your left side, right below your rib cage, sit it there and leave it there. And it can be a little bit uncomfortable because it's rather cold, but if you put it on your stomach and just leave it there, and let it hang out for half an hour, you'll find, I have found, that it actually works better than the pain medication. The ice really does help improve the pain in your pancreas. Anytime I'm in the hospital for pancreatitis, I ask for bags of ice so I can place them on my stomach, because it really does help numb the pain in your pancreas. And I honestly do think that the ice works better for your stomach than most pain meds do, because it just helps numb that pain a lot. But once again, for the most part, ERCPs aren't that bad. And, it's one of those things that it could potentially, save your life. It could potentially help relieve a lot of discomfort, a lot of pain, especially if you're one of those people that has chronic pancreatitis. Yeah, if you're one of those people that has chronic pancreatitis and you've been dealing with, a lot of pain, and it's constant all the time. It could potentially be that you have a blockage in your pancreatic duct, or there's scar tissue in your pancreatic duct, and going and seeing a gastroenterologist or a GI doctor, and speaking with them, it might be one of those things that they might want to perform as an ERCP. And I can honestly say, from experience, that having the ERCPs done, it wasn't immediate. I didn't get immediate relief right away. But over time, after having the ERCPs done and the work that they did in there, greatly reduced the amount of pain that I dealt with. I still deal with pancreatic problems, but, my pancreas is shot. It really is. I went and had an ERCP done because they had to place some more stents. It was February of this year. And I think it was the last round of the stents that they had to place in my pancreatic duct. And then in April, they went to remove the rest of them. From February to April, when they went to remove the last bit of the stents, my pancreas had shrunk in half over that period of time. I've just had so many pancreatic problems, and it's because I had pancreatitis over and over and over again. Never did anything about it. Didn't know what was going on with me and why I was having, these stomach problems, why I was getting sick all the time. But now, since I've been in the hospital and have been diagnosed with pancreatitis over and over and over again, I know exactly what's going on. I know what pancreatitis is. And back in the day, I had pancreatitis. I don't even know how many times. It was ridiculous how many times I've had pancreatitis. And the worst part about it is, and I've said this before, but I would get pancreatitis and then I would drink on top of it, hoping that would help with the pain. Because I drank as a pain reliever. And I drank for all kinds of reasons, but drinking was what I used as a pain reliever. And, alcohol works for that, sometimes. It dulls everything, and it can dull pain. You get so drunk to where you don't even know what's going on. But I'll tell you this, it does not dull the pain in pancreatitis, it is pouring gasoline on a fire. It just makes things 10 times worse. So if you think that that's what you're having, if you think that you might be having pancreatitis, please go speak with a doctor, and don't drink on top of it. It will make it worse. That's one thing I can promise, is drinking on, while in pancreatitis is not a good idea. But anyway, guys, that's it for today. Like I said, I just wanted to talk about what an ERCP is, what it's like, and just bring some education to this today. I'm sorry about all the noise from the rain. I didn't want to film inside today, and I know it's a little bit, it's a little bit loud in the video, but I hope that you were able to understand me enough just to hear what I was saying, and like I said, get a little bit of education about ERCPs. And if in fact you think you might need to have one done, just go for it. It's worth it. I can tell you that much. It really is. The work that they can do now, the technology that they have is just absolutely mind-blowing, and it's awesome that we have these tools that they can use and be able to help us. I'm sure probably 40 years ago they would have had to cut you open to do this type of stuff, and now they can just do it. They can go right down your throat with a scope, and no incisions, no anything. They can do that stuff just like that, and it's a heck of a lot easier than it used to be, I'm sure. So thank you so much for watching today, guys. I truly do appreciate it, and I love you guys so much. I really do. You guys are all so awesome. It's such a blessing to have so many nice, awesome, amazing people here in this community. I really do appreciate each and every single one of you. So until tomorrow, I will see y'all then. Y'all have a great rest of your day. Bye-bye.